It seems like just about everyone is at the end of their rope right now. Dr. Mollen is joining us this morning. We know COVID is really kind of taking a toll. I know that, after 7 months, a lot of people hitting their breaking point. We've been stuck at home, or if we're going out, things are just weird right now. Talk a little bit about mental health, because it seems like just from folks around me, a lot of people for the first time in their lives are having some serious mental health issues.
Yeah, there's no question about it, Kylie, and good morning to you. We're seeing a lot more people abusing alcohol now. They say that's increased by about 50%. Drug abuse has increased by about 30%. We're even seeing an increase in suicides, particularly between the 18 to 24 age group and also the essential workers. So this is a serious problem. And again, it's not only the stress, it's the boredom, and that depression is setting in. And if you are feeling any of that, that's when you ought to see your doctor. A lot of people are neglecting their doctor appointments right now, because they're afraid of getting COVID in the offices. So I'd underscore the importance of going to your doctor's office, particularly if you get any type of depression. The simple things in life, like talking to friends, giving people a handshake, a hug, those things are off the table right now. And so all of those things have contributed. Going out to eat or going to a movie, the things that normally take the stress off the table, those are the things that have had such a significant impact on all of us. Kylie.
You're stressed about your kids. If you have kids, you might be stressed about your job, if you've lost your job, or if there have been cuts.
Yes.
There's just so much. And I think that a lot of people who've never been in that position before have to realize it is okay to ask for help. You don't have to be embarrassed or ashamed.
Exactly. Yeah, no question about it. So what can you do, actually? So you can exercise, of course. Set up a regular schedule for yourself. When people are working from home, it's too easy not to have a schedule. Maybe they are used to getting up at 5 in the morning. Now they're getting up at 7 in the morning. Have a regular schedule. You need to make sure that you get adequate sleep. I think that's going to be critically important. Do some type of exercise, whether it's walking, jogging, bicycling, swimming, something. A lot of people have gained weight during this time. They call it the COVID-19. Patients ask me why it's 19. Well, that's related to 2019, but they often think that it's those 19 pounds that they've gained, and that's the reason for it. So again, watch your eating habits. More salads, fruits, vegetables. Eliminate the pasta, the rice, the potatoes, and the bread. Those are the things that are going to pack on those pounds. And again, if you're smoking, that's another contributory factor that's going to increase your risk for developing COVID. So you have to really change your whole lifestyle. Look for simple changes. What people do often is they try to make huge changes, and that's what the mistake is. And because they can't do that, we have to just take it one step at a time. Be hopeful. Things are going to change. I know they're projecting 395,000 deaths, but again, that's a projection. So we're back to the basic things, and that is wearing a mask, social distancing, kids going back to school. It's not just the children that we have to protect. It's the parents, it's the grandparents, it's the people who they are going to bring it home to. So I think all of those are critical factors right now, Kylie.
And good reminders, especially for all of us, including myself. Before we go, we do want to talk a little bit about President Trump. He was diagnosed with the coronavirus. Yes. The White House says not this Thursday, yes, but last Thursday. And according to a memo from his doctor, Dr. Sean Conley, he has been cleared to return to an active schedule. Talking a little bit about that, do you think that is enough time? What is the CDC's guidelines as far as current guidelines with that isolation period?
Right. So, yes. So basically the quarantine period and the isolation period, if someone has it, is basically 10 to 14 days. It's a novel virus, so we don't know for sure. A lot of people are saying it should be 20 days. And if we don't know whether the president has had basically a negative test, and no one has said he has a negative test, and I think that's a big mistake, on the part of the White House, on the part of the CDC. I think they need to come out with some specific specifics and let us know what's going on. I mean, as far as I'm concerned, again, it should be more of a 20-day period. I think that's going to be much better for him and for other people, and he's at an increased risk. They gave him massive doses of dexamethasone, which is a steroid, and that can make people feel very, very good for a short period of time. But the consequences of that later on can be diabetes, it can be heart irregularities, it can be lung problems. We still don't have all the information from his doctors.